Hello, in this video we will talk about the tracheostomy, the different types of tracheostomy, and the parts of a tracheostomy. I will also show you how to use your ambu bag should your ventilator stop working or you have to travel with your patient. So on this table we will start with our fenestrated tracheostomy, and this is a Shiley number 10. The FN is a fenestrated. This is also a Shiley number 10, but this one has a cuff. So we can have a cuffed fenestrated or a cuffless fenestrated, or we can just have a cuffed tracheostomy. Now, the thing about the tracheostomy is with the cuff, most of these are used when we have patients that are on ventilators or a breathing machine that we are having to breathe for that patient. There are 3 parts or 4 parts to a tracheostomy, with this one being the cuff. We'll just talk about this one first. There is the faceplate, and that part fits right up to your patient's skin here in the trachea. Usually your trachea cut is between the 3rd and the 5th tracheal ring. So it'll be somewhere on your neck, like just like this, all right? Then there is the outer cannula, or this piece right here. There is a pilot balloon on this one because we have a cuff here, or a balloon. The other word for that is a balloon. And then inside, finally, we have our inner cannula. So all the parts of this, and our pilot balloon helps us to know how much air we have inflated into our cuff. So if we take a look at it, I'm going to insert some air in it now. So what I'm going to do is I'm going to take a 10 cc syringe. I'm going to attach it to my little pilot balloon, and I want you to watch our cuff and see what it does. As I'm slowly pushing air into it, you start to see our cuff make a little balloon. Okay? In the meantime, while this is also becoming a balloon, which you see I can squeeze, that is what I want, our little pilot balloon here on the end is also airs in it. So when we press this, if this is very tight, the balloon on the very end of our trachea will also be very tight. The purpose of the balloon, having a balloon here for our ventilated patient, is to prevent air from escaping. We live in a negative pressure world. So as we walk around, we breathe normally without any problems. In respiratory failure, we lose that ability to breathe in our negative pressure environment. So then we have to do positive pressure ventilation, where we have to force air into the lungs through our tracheostomy, or trach, if you want to use that for short. All right, so you will use this. Once this is inserted by our physician in that 3rd or 5th ring here, the balloon is inflated. Our balloon prevents air from escaping that we force into our patients. So once we breathe into our patients using a ventilator or an ambu bag, this will prevent the air from escaping our pilot balloon, okay? We just need to be very careful that we don't have too much air, because it will damage the inside of our trachea. Then with that being, we would place our inner cannula inside of our patient's outer cannula, and now we would monitor our patient. We would also have to, and your hospital or institution may use something different, but these are trach ties that will come into the kit that will fit into these little holes on each side and tie around the patient's neck to prevent dislodgement of our tracheostomy. That is our cuff. All right, this is our cuffless and fenestrated. The parts are going to be the same: the faceplate, the outer cannula, but do you see your fenestrations? That's why it's called fenestration. And then this one is cuffless. So it can be used on a patient that is probably not ventilated, that probably does not require us to breathe for them. The inner cannula is also what we would use, that we would place it inside there. If we're going to have air to flow, our inner cannula will probably be also fenestrated, which means holes in it. That's all fenestration means. But it will allow air to go over our vocal cords or our larynx or our voice box, and your patient may be able to speak or make sounds with a cuffless fenestrated tracheostomy. With a cuffed or balloon, your patient should not be able to make any sounds or talk to you in the case when this balloon is inflated. So those are the three parts. Now, this little tube thing part right here will also come in your tracheostomy. It's called an obturator. We like to keep this at our bedside. We will tape it to the wall. You will find them in a patient that may have been trached, especially those who are newly trached. What this is your guide. So if we ever had to see how it's very hard, it's non-pliable, whereas your trach may not be, you would just use that to insert, and you see how it comes out that end? That makes it very smooth so that we don't cause damage to our trachea. All right, our final one is that we're going to talk about is our pediatric. Oh, y'all, so cute, so very cute, but help if we ever had to do this. They also have a little obturator, very tiny, and this is what their little trachea would look like. So very different. It's very rare that you would have a cuffed pediatric trach or ET tube or anything. Usually when we put them, they're not cuffed usually. All right. So we would use the same thing, our little guide. Okay. And you will also notice that with our pediatric, that it's much more pliable, much more movable, even our little ties and things that we would use. Then we also have trach ties for this that we would also put in our little hose and tie them around the neck. Okay. Your hospital, again, or institution may not use these little ties at all. They may have their own little tracheostomy holders in their institution, which we would like to use instead. All right. The last thing I really want to show you is don't panic. So many times I've seen nurses that they just panic. So let's just talk about it from the sense that your patient gets into trouble and they're having trouble breathing. If you have ever used an ambu bag in any situation where people cannot breathe, you would simply do the exact same thing with a trachea. So this would be your ambu bag, all right? You see, you got your little oxygen. I'm going to put this back on here because I want to tell you something about it. You got your little reservoir bag. You've got your oxygen tubing that you would attach to the wall for your oxygen. And if your patient was not trach, you would use the nose and the mouth. You would use the mask. So this we would bag valve mask. We would take this, and of course this would go to the nose. This would go to the chin. But because we have our patient that has a tracheostomy, we're going to do things a little bit different here. So we will remove this little faceplate because we don't need it. Make sure our ambu bag is attached to oxygen. And this just means that, whoa, what happened? My ventilator stopped working. Or I'm going to travel with this patient and I don't have a portable ventilator. I can bag my patient. Okay, so if you look at the top of your tracheostomy, the part that comes outside, you would attach your ambu bag and voila, you can start bagging your patient. So you would just simply bag your patient. You don't need to do this. That's not necessary. You just simply need to breathe that every 6 seconds like you would if you were doing a normal breathing. It doesn't matter. You're still going to breathe for them. All right. So we would just simply squeeze and release. 6 seconds, we would squeeze and release. And that's how you would bag your patient if for some reason your ventilator quit, you had to travel with your patient, you didn't have a portable ventilator. It's just that simple. So always, always, always keep a ambu bag at your patient's bedside, one that you can readily, easily grab and start bagging your patient. Okay? That is it, folks. I am so excited that you decided to hang out with me to learn a little bit more about tracheostomies and the parts of a tracheostomy and what they're used for. Thank you. Have a great day. If you like this video, go ahead and hit the like button. Go ahead and subscribe to this channel so that you'll know when I put out more videos, because we are always learning.